We are good to go live.
Is it okay?
Yes, we are good to go live.
Okay. Good evening. Welcome you all to Yashoda Hospital's Experts Appraisal of Emergency Medicine. Today, we are bringing to you all how ED administration and leadership will frame the emergency department operations. I welcome Dr. Raghu Kondle, who is a senior consultant and head of the department Malakpet, for giving this valuable talk. Very often, emergency medicine is a specialty which deals with crisis all throughout the time, not just in times of resources, in times of time and people management. So an ED director should have the skills of managing all these three to have an efficient emergency rooms. Over to you, Dr. Raghu, for your elaborative talk on ED leadership and management, administration. So the apt title is Control and Command of the Emergency Department. Over to you.
Yeah, thank you, Sowjanya, for the kind introduction. So ED administration and leadership. So these are the following leaders which I have encountered in the last 20 years. First is my boss, where I was trained, Dr. T.V. Ramakrishnan. Then my colleague whom I have worked with, he was in the administration. Then the other colleague with the semi-key role, Dr. Srinath and Dr. Imran Subhan, and the upcoming leaders are in the front line. So the first thing is see in the mirror and see, are you a leader? So a leader can always, he can lead from the behind, or as I showed in this image where you can see in the Bahubali, where he can lead from the front by not disclosing who is. So have you perceived yourself in the mirror saying that, are you a leader? So you're, sorry. Yeah. So your perception of me is a reflection of you, and my reaction to you is an awareness of me. So how you perceive yourself isn't necessarily, but how other people often perceive you, that matters the most. So becoming a leader, it is not easy. So you need some qualifications, some qualities to becoming a leader. So first see in the mirror yourself whether you are a potential leader or not. So the three effective leadership in the emergency department is, so you have to gain followers, the first one, and you should be a role model to the your own ER department, and you should value a team. So you should not be selfish always. So you should always value a team. So you should gain followers. So you should be a good role model to your colleagues, your staff, everybody. And lastly, you should value your team. So this is the three effective steps for becoming a good leader in the emergency department. So first thing is, whenever you see in the mirror, see that identify whether are you having any flaws in yourself. If you are having any flaws, you try to correct yourself, stepping into your leadership. So next thing is gaining followers. So followers will not come as whenever you want. So for this, you have the following things. So you should be always a role model, and you should be a So you should be a role model, and you should be to the department and for the department rather than being isolated. Ideally, it is not. So if you want to gain followers, again, you should have some qualities. So what are the qualities you should have? You should be visible in everywhere, and you should be authentic. You should be communicative to everybody. So even a class 4 or even a security person is there, you should be communicative. So you should not see, I have this position, I can't talk. It is doesn't work here. So you should be approachable, accessible to every person in the department, and you should understand them. So whatever they say also you should listen, rather than it is the one way. It should be a two ways. So they should be approachable to you whenever there is a crisis or whenever they have an issues. You should be visible, authentic, communicative, and you should understand the issues there. So this image replicates how a leader is leading from the front. So you should always come front for the any problem or any crisis or any issue in the department or for the people for the department. So you should be visible, authentic, communicative, and you should understand. So you should always lead from the front. So simultaneously, you should be always a good clinician. A good clinician only can have a good leadership quality. So when you are a good clinician, so automatically the leadership will always come. So the 13 cards of ED administration, one by we see. The first thing is patient care and satisfaction. Second is psych of your people. Third is the place where you work. And fourth is paraphernalia. Fifth is protocols, guidelines. Sixth is problems of which can be acute, chronic, and what are the solutions. Seventh are the periodic drills. Eight is professionalism, punctuality, work culture. Ninth one is publications, research, audits. 10 is your paperwork. 11 is pedagogy. 12 is Paisa, penny, and 13 is your politics and your leadership. So we'll go by one. So first thing is your patient care and clinical satisfaction. So administration leadership, so which includes everything. What are the 13 cards I said? It doesn't mean only the administration or the, so everything comes into this play. The first thing is clinical satisfaction. So whenever a patient has come to the ED, so after examining the patient, so explain the process. So what are the issues which have been identified, and what are the things you identified him, and take a thorough history, listen to them properly, and tell them what are you going then. So the patient, somebody is in the pain thing, first give a pain, do a symptom relief, so and calm down. Then comes your diagnosis. So once everything is done, the diagnosis will be made. Then reciprocate to the patient, and then the therapy starts. So then only you have a clinical satisfaction in your department. So the process, the symptom relief, the diagnosis, and your therapy. So what are the other things where the patient can have a non-clinical satisfaction? So the tone somebody speaks, or the tone you may speak to address them, the noise. So most of the ED, it may be chaotic sometimes. So everybody may be shouting for whichever the thing. So try to calm down their department. It can be anywhere, not even this thing, anywhere. Then there should be always a brightness in the department. So it should not be dull. So see that the patient, so once it has been shifted outside also, they should be have a brightness of brightness in the room or everything. If feasible, the doors and the windows can have a transparent thing where they can have access to the outside area and the diet. So most of the patients who come to the hospital, they may not be having your satisfaction with the diet. So once they will be labeled as a patient. So the patient, these people will be subjected for the patient diet. So that's why they can have a non-clinical satisfaction. And the second thing is the time. Time can be anything for even the triaging, so attending of the doctors, collecting of the reports, cross consultations, imaging, everything. So these are the things where they can have a non-clinical satisfaction. So the patient care, so patient satisfaction, once they have done, the patient's attenders can give your feedback. So patient, basing on the patient satisfaction, the attenders feedback can be a good, bad, or worst, or so it can be a super. So you have the quality parameters in the ED. So as all the ED departments, they maintain some certain clinical parameters like the door to triage step. So as soon as the patient come, the triage staff doing a triaging as early as possible based on your triage of the patient. It can be 1, 2, 3 or the 4, and then to go to management time. So what was the triage time and what was the patient history taken, what is the diagnosis and what is the treatment done, and revisit within 72 hours. So patient who has come to the ED, example you take today, and some of your colleague has seen who has not gone in depth of patient history. So where proper history may not be there, proper evaluation is there. So they may revisit within the 72 hours. So look into your department that you do not have a revisits of within 72 hours, and etc. The medication errors. So writing a wrong medication, addressing the wrong medication, and even your anaphylaxis of the medication. Then nurse-patient ratio also plays a major role. If your emergency department, if you take a 20-bedded and if you have only 2 nurses and the ED is always full, again there will be a nurse-patient ratio dissatisfaction. So this has to be addressed to the admin, saying that basing on your triage intake, and you have to increase your nurse patient ratio and the investigation start time. So when the patient has come, so investigate blood has been drawn or the imaging or whatever it is, so the investigation start time also has to be looked in the ED. So the parameters can be door to triage time, door to management, revisit and your medication. So these are the only some of the quality parameters I have told. So there are many other clinical parameters which can also be discussed. So this is my department at Malakpet. So if you take, you have different people in the department. So all people may not be having the same uh, those same psych everything. So some may be a dreamer, some may be a social, some may be impulsive, some can lead from the front in the beginning of their residency, some can be introvert, and some you have the odd person in the department, the rebellion. So you will have a different people in your department with all these characters. So you have to be ready for handling all these different kind of people in your department. So when you see in the mirror, this how it can be a reflection of your people. So a good person may not. So in the department, if you take patient may be having a good or habits, bad habits, and patient may not be doing well in the department, and a perfect person who doesn't smoke, doesn't drink, doesn't cry, or doesn't feel, he may not exist. So a person may have all these characters. If he has all these characters, it doesn't mean that he is bad. So without any of these qualities, a person does not exist. So you will be having a different kind of personalities in your department. So next is your communication and your expectations. Communication of expectation. So this has to be like so people in the department, they expect you to communicate properly and always be approachable and always be accessible and always listen to the people in your department. So again, leadership is not a single thing, it is again your teamwork. So a bunch of your fist or your hand, if it takes only, it is your thing. If you take individual fingers, it doesn't form your fist. So leadership means again for your security to your HOD, it all together forms your leadership, that is your teamwork. So next in the people in the department. So the people in the department, again, your staff, your residents, your registrars, your colleagues, everything. So end of the day, it is you have to take care them of the department people or your staff. So you have to see their whatever issues. For example, you take the remuneration. So see, he might be joined 5 years back, but his salary is the same thing, and his salary there will be not any hike in the salary. So that you have to go to the admin people, discuss with for their salary hike and their career progression. The people in the department are joined with the basics, so you have to make a career progress for them in their new department by making them do basic courses, by doing them in your research projects, everything. See that what it suits them in your department, and appraisals and promotion. So this plays a major role, recognition of them in the department and giving appraisal to them whenever this, and promotion basing on their experience, their performance in the timely manner, and lastly they should have a job satisfaction when they are working with you. So everybody may not be having this the job satisfaction. See that how much you can do for them a job satisfaction, that has to be addressed in the people with you in the department. So again, you should be having a scheduled team event. So uh, get-togethers like a monthly gathering, conducting a CMEs, or freaking out in the Saturday, Sunday, celebrating their birthdays outside, conducting a CMEs. It can be anything. So that make you unites you, bring your bonding. So schedule in events is equal to your sense of belonging. So the department, your colleagues are saying, celebrating them, their birthday dates, then you are even simultaneously taking care of your staff, doing whatever it is needed for them in the timely manner. So coming the third one is place. So the emergency department may not be quite calm as shown in the display in the picture. It may be chaotic always. So you have a busy department where the triage is always overflowing, because one thing, it can be a busy hospital. It may be the only hospital that place. Yours can be a trauma center. And lastly, shortage of beds where the ED is always dumped with all these kind of the issues there. So what do we see here? A quiet place again turning into a chaotic area once a sudden surge of patients or a mass casualty suddenly surging into the department. So you should be aware of the complete logistics of your hospital. So which place it starts. Well, first you should know about your department, again your hospital. The whole organogram of the hospital should be net. So from where the ambulance is entering, where the parking area is for the ambulance, and the other issues, whether you have acute treatment area, the support staff, everything you should have. So different hospitals, different, they may be having, so it may not be as which I showed. So the ambulance areas, again the imaging area, the consultations area, the waiting area, again the observation area, everything has to be look into it. So third is your place, the place where you work or the place where you start your journey. So you should be aware of the roles and responsibilities of the ED consultants. The day shift, so it starts with your rounds and bedside teaching as shown in this picture. It can be like from 9 to 10 we can have your morning rounds or bedside teaching. Then followed by the next hour, you can have the attenders counseling the overnight patients or the fresh patients where you need your counseling, or if you have a ED issue, there also you can finish off this counseling. Then your facility management, which plays a major role. So allot a time for your facility management, nothing but your overnight issues or the issues which are there in the department. So taking time, going to that admin, addressing them and searching for the solutions. And then you are allotting time for the teaching for the junior staff. So this also should not be missed. Next comes your administrative responsibility. So that has also to be important for the ED director or the ED consultant. So at least spare a good time for administrative responsibilities. And again, once you wind up again to your evening runs, so that you can plan for the night shift doctors. So what are the issues there from the morning, you can brief them once they have come. So this facility management plays a major role and this should not be missed. So all your ED department, they should be having this, or most of the ED departments have, you should have a good ED reception, a good ambience there, and a good triage with a triage nursing and a doctor available there, at least minimum 2 to 3 beds. So once the triage is done, then there should be a ED waiting area for the attendants to there, and a ED pharmacy and ED pharmacist within the department, and a isolation room when you have a positive cases or a cases that has to be isolated with a negative suction if available, and a procedure room. So all the procedures which done in the department, like can be a cannulation, like ICD, a tracheostomy or anything. So you should have a separate procedure room, so which can not be disturbing to the other patients, and a radiology service round the clock 24 hours, and a restroom. This also plays a major role for all the people in the ED. The restroom should be for the residents, registrars, consultants, the staff, and even for your patients and the attendants who are there in the ED, and the 24-hour cafeteria. And this plays a major role for at least little bit taking relaxing. So once after a busy schedule, so taking a time of 10-15 minutes going to the cafeteria and having a cup of coffee or a tea. So, and lastly, a billing access where there are patient should not be roaming everywhere. So, a billing access in the department again is needed. So, fourth in one is your paraphernalia. So, having the equipment is not only important, but having the equipment with the facilities, and whenever there is an issue, so you should be solving it, and you should have the person who solves in these things. The issue in the monitor or any CT X-ray machine, so there should be an access of somebody to solve the issue, and whatever the gadgets you should have, it should have a high end with everything accessible. So having an adequate or these basic things like a glove, cap, mask, and your surgical gloves. And whenever you have a patient with who has requires these things, again these things also should be available in the department. Again, lastly, a wind finder. So whenever in a difficult cannulation, all these again plays a major role. So now the fifth one is your protocols and guidelines. So each hospital may be having a different protocols, but end of the day, the protocols will some of the other point will have a common thing. So selection of protocols for the clinical issues, you should have something, and a non-clinical issues, and it should be applicable locally. You can't bring international guidelines and keeping it to the local hospital. So whichever it is, it should be applicable, feasible for everybody, and it should be available easily. So having a protocol, seeing that nobody knows, again it doesn't serve the purpose, and you should be regularly updated. So the updation should be everything, your infrastructure, your training, everything should be updated, and you should have the norms of your NABH or a JCI, these protocols and the guidelines. So problems and solutions. No ER will be there without these things. So whenever there's a problem, you should search for the solution. So think as I showed this picture in the slide, so ER can be always this waiting for your number when it comes. So managing the patient surges daily. So this problem can be there. So addressing day by day to your admin group, searching for the expansion of the ER or a waiting area or something cases which can be triaged and shifting them as early as possible. So and these solutions should be reviewed periodically. So that's why the facility rounds, as I said, so this if you take half an hour or 1 hour daily, so these of the problems which are there can be discussed in your facility round. So a problem and solution. So action speaks louder than words. So whatever are the problems are there, again you should have a solution with them and go and discuss with your managing staff. So regular tabletop exercises and drills are important for your training for your departments. Then for every 3 monthly or 6 monthly training of different, it can be a code red or code gray. And as in a regular NABH process, you should have a frequent every 3 months, 6 months tabletop exercises versus your drills. So periodic drills to assess your preparedness. So this can be done every 3 months or your 6 months. So these are some of the things we had recently in at our hospital. So professionalism, your work culture. So the first one is your grooming. Grooming from everybody plays a major role, which shows your appearance for the your colleagues, your staff, everything, and for the patients who are coming. So everybody, whoever it is there should be a proper grooming so that they should be in a professionalism. And antiquity should be there, everything available. So the cap, mask, everything should be there, and punctuality. So the punctuality should be there for everybody in the department. Here, the leader or the boss or the administrator, whoever is there, the ED director. So if he is punctual to the department, to the work, and he is committed, so the department colleagues, the staff will always follow him, and always follow should be a infection control practices. So whenever you are touching the patient and after touching the patient, as we have the 5 steps should be followed, and the procedures whatever we are doing, and the bins whatever the biomedical waste management, everything has to be checked, addressed regularly, followed. And the ethics also plays a major role in the department. So the ninth one is publication, thesis, research, and audits. So for the department to grow, to progress, for the betterment, so these parts are major role. So and it is part of the ED training. So all the residents, registrars should be encouraged to do publications minimal in their residency, and even your registrars who have joined them assign some work for their future thing. And the research audits every 3 to 6 months you audit for the each person in the department. And audits, what they do, they improve the quality. So what are the audits you can have? The CPR audit monthly, the mortality audit, so that you can improve your quality of the department. And so with this shows the identity of the department. So a good patient research stated in a good outcome will bring laurels to the department, and whatever publications you do which get published in the international index journal, and again it also shows your identity. So these are some things which have acknowledged to our department at Malakpet. So the 10th one is the paperwork. So again it is in the for the everybody in the department, the emergency record, the triage thing, and the referral form to the other departments which are needed for the patients in the year, and the drug chart and the accident register. So these things again has to be had a thorough look in the day by day, so that there will be no mistakes in any of these things. So you may be having letters to be written there. You may be having the own certificate. Some of them are applicable to us and some may not be applicable to us. Some may be dealing with the junior admins or the RMOs or the consultants of the other departments. Like if you take this letters of insurance can be, so the wound certificate, alcohol certificate and leave certificates which are a part of our job. And lastly, certificate, everybody may be roaming back or behind us for their certificates. So when you think you are stressed and when you not are required there, so always involve the MRD and assign them. So lastly, you should have a dedicated X-ray time and allot time for the MRD for the any cross checkings of the X-rays, and it should be clear and it should not be any ambiguous, and there should be no duplication of work because you have a medical legal cases to be monitored, so there should not be any duplication of the work. So the 11th one is pedagogy, which is part of our teaching program. So you will be conducting the regular lectures, you will be giving lectures, and the students they'll be giving their classes, conducting of seminars every 15 days or monthly ones, giving them assignments whenever you are in the at the bedside teaching or in the class. You can assign them anything if they are not up to the mark, and periodic testing should be done. It can be done every monthly or every quarterly. And what are the audience you are searching? That your department only is a audience. There is no need of any other coming for these things. So your staff, your residents, your paramedics, your registrars and consultants only can be your audience for your teaching program in your department. So this is how some of the things which were in the department audience. So next is end of the day, whatever we do is we do for the Paisa. So again, the thing is revenue generation and sharing. So whichever some departments they have a revenue to the department and share in between the department people, and how much you earn for the department again it reflects there for your salary outcome also. So that also has to be linked in between. So as we have Swachh Bharat says GST everything, so this also plays a major role. So balance should be there in the department. So it should not be only one side, only giving your work and not having a good salary for the thing. So 13 one is the major part is the politics. So this is the thing where which you have to handle with gently. So management satisfaction, whatever you do, however you do, management at end of the time they will be not satisfied with some or the thing. So that has to be kept in mind. Department autonomy. So you may be having some misunderstandings, clashes with the other departments saying, so these kind of issues can be there, and in which can be having a interdepartment relations policy. So always we have to keep our calm, down the adrenaline thing, so and paper good interdepartment relationship. So classic and modern theories of leadership should be studied by anyone wearing the mantle of leadership in emergency medicine, and the repolitic of the modern hospital must be accommodative leadership efforts are to be succeeded. So for the interdepartmental standing, having a interdepartment classes or exchange programs can be there. So going them for a cup of tea for the lunch, everything, and having a good department of the interdepartments. So some can be feasible, some cannot be feasible. So we should give ourselves a try and see. And don't burn bridges, be firm, don't be rude, and always involve the management. So whenever there is an issue which is crossing the limit, always try to involve the management rather than you taking the burden everything on your head. So sometimes you must lose a battle to win the war. So what are the operational challenges in the ED administration? So the first thing what we notice is a patient overcrowding. So patient overcrowding can be there because one may be a tertiary hospital, only hospital there, lack of beds outside, lack of beds in the ER, and lack of beds in your hospital. So which can be peak into the overcrowding and resource management. So resource management again, so may not be keeping adequate resource to the department instead in spite of your busy department. So this has to be take done in your facility management daily and flow efficacy, financial constraints, technological integration, legal and regulatory compliance, and patient satisfaction. So these are the challenges you have in their workflow efficacy can be their financial constraints. So patients who are coming to the ER, they may not be affordable. So that plays a major role and making the patient stuck there. And technology integration, sometimes you may done with your packs which will not be working there. Legal and regulatory compliance, this has to be looked in. And patient satisfaction, somewhere be there, how much you do, the patient may get satisfied or may not get satisfied. So the future trends in AD administration is integration of AI and machine learning, AI for all predictive analysis, and you can use this for your triage optimization and for staffing and resource allocation. So this might come in the future. Telemedicine and future care, remote consultation or non-urgent cases. If somebody wants this, you can be doing from the ER. Enhanced patient monitoring through wearables, improved access for your rural and unserved populations. Third one is your data-driven decision making. So real-time analytics to optimize staffing, patient waiting times, and treatment outcomes. So you can use your EHR to improve the patient care and coordination. Patient-centered care models. So implementation of patient flow teams for a better navigation and communication. And fifth one is workforce optimization and well-being. So emphasizing on the burnout prevention and mental health support. So all the people in the department may not take the same stress which can be there. So handling your colleagues, your staff, seeing that they will be not having a burnout landing in the mental issues. So there should be a flexible scheduling and improvement staff engine through technology. So frequent scheduling and improve staff engagement through technology. So taking different kind of programs for improving their knowledge. So advanced staff modeling. So AI predict patient volume and staff needs. Increased reliance on nurse practitioners and physician assistant for non-critical care. So for non-critical care, you can use um, this nurse practitioners and your physician address assistants to address the issues. So fifth one is again your disaster preparedness and response. So quarterly triage, mock drills, which can be helpful for handling any of your mass casualties or your pandemics. So use of mobile units and rapid response teams to bring down this. And this image shows this is one of in your corporate hospital where you can see the AI integrated everything in your patient room. So coming to the summary, so what is leadership? Your perception of me is a reflection of you, and my reaction to you is an awareness of me. So a leader is nothing but you should identify yourself and identify your flaws. If you're not able to do this, you cannot be a good leader. So again, leadership again comes with gaining of followers. So for one followers again, you should be authentic, should be communicative, you should be visible for everybody to gain followers, and you should always lead from the front for any of the issue. And a leader again should be a good clinician in the department. So coming to the 13 steps. So patient care and satisfaction, psych of the people, place, paraphernalia, protocols and guidelines, problems, acute and chronic, and solutions for them, periodic drills, professionalism, punctuality, work culture, publications, research, audits, paperwork, pedagogy, Paisa, Penny Revenue and Politics and Leaderships. So leadership in the emergency medicine, all the ED directors, all the ED consultants should have a leadership skills. They should be working again in a team rather than isolated, managing the emergency services to the prop, and there should be a growth and collaboration and developing excellence within your team. So these are the leadership in the emergency medicine. So I conclude this talk with the effective leadership is the backbone of high functioning emergency department, and as an healthcare landscape evolves, strong adaptable leadership will remain key to the success. So thank you. So this was my thing from the. So if there are any questions, we are ready to take. So if there are no questions, we'll wind up the session. So I thank Yashoda Hospital in association with SEMI and NBI. So bringing a different topic every week with an professional in the ED department, bringing newer concepts for the people. Thank you. Sandeep?